Hey, it's Janae with Daily Dental Hygiene, and today I'm going to be talking about the Sonicare versus the Oral-B toothbrush, which is a toothbrush for you, and I'm going to come up with some pros and cons for both. So first off, let's just break them down. Sonicare has a toothbrush, manual toothbrush-like head. Oral-B has a circular brush. So these are good for both different reasons. First off, the bristles on the Sonicare are longer than the Oral-B. So if you have nooks and crannies, recession, I have a little bit of recession, food gets impacted into my teeth, I like the Sonicare. I think the bristles are longer, they kind of get into my gums a little bit better. But I really like the Oral-B because of its circular head. It wraps and kind of hugs the tooth. So if you have recession, you get food impaction, there's gaps in between your teeth, I like the Sonicare for you. If you have gingivitis, bleeding gums, puffy gums, it's great for orthodontics. If you have braces, I like the Oral-B for you. So these are just kind of things you have to see, what is my current oral health and what do I need to focus on. So let's talk about the price. Oral-B is a lot cheaper than Sonicare, unfortunately. It is cheaper. If you go to Walmart, Costco, Target, wherever you like to shop, generally, the Oral-B has base models that are very cheap, like around 50 bucks. But Oral-B actually just came out with a new brush called the IO Oral-B. It is a really good toothbrush. I do want to disclose it is about $300. So if that's something you can afford, awesome. Love this toothbrush for you. If it is expensive and out of your price range, totally get it. It's out of my price range personally, but I got it for free by an Oral-B rep. So that's why I have it. I really like it. I really recommend it to patients. It's very quiet. I know in the past Oral-B has kind of been knocked for having extremely loud rhododent type of sound, and they've really worked and to try to make the sound a lot more like a Sonicare, where it's a soft swishing sound instead of the loud sounds kind of like a drill. The bristles are really good. It really cleans your teeth well. And it has a lot of, Bluetooth technology that's really kind of cool to experience. But the Sonicare, like I said, is the one that I use for my recession and kind of getting in there well. And it is a lot cheaper than the IO Oral-B. So with that being said, figure out which toothbrush works for you. Ask your dental hygienist or your dentist what teeth you have and what toothbrush they recommend for you. And with that being said, always use an electric toothbrush. It is way better than a manual toothbrush. You physically just have to put the toothbrush to your teeth. It does all the work, so I 100% approve of electric toothbrushes. Also know that there are different toothbrush heads out there. There's soft bristles, there's ones specifically for braces, there's ones that are for whitening, for a deeper clean. So evaluate your gums. If you have recession or sensitivity, maybe a soft bristle head is best for you. If you have braces, they've got the one with the little ortho brackets. So do your research, go on Oral-B and Sonicare, find which ones are going to be best for you, and always tailor your dental hygiene needs to the products you buy. Thank you. Take care.